Hi, Callum here. So we've got a biopsy here from the next part of the GI tract, which is the duodenum, which is the first part of the small intestine. So we've got quite a different appearance from the last biopsies, which were from the stomach. And for the most part, the small intestine looks broadly similar throughout, with subtle differences throughout its entire length. So we'll just look at the duodenum, then I'll just finish off by talking about the rest of the small intestine quickly. But the normal structure of the duodenum, or indeed the small intestine, is got a villus structure, villus surface. So unlike the stomach, which had quite a flat surface, under normal conditions, the small intestine is largely villus, and that's because having these villus, by villus I mean it has these villi or finger-like projections. This is the luminal aspect here, and these villi project into the luminal aspect, and they vastly increase the surface area, and which reflects the fact that the small intestine's job is largely absorptive, so it needs to have lots of surface area to absorb all the things that it needs to from the luminal contents. So this is normal. This is a normal appearance. So these are the villi, which are lined by simple columnar epithelium. So we've got at the basal end, we've got these nuclei that are all lining up, and towards the luminal side, we've got this cytoplasm. Now, there is what's known as a brush border at the very luminal aspect of the cytoplasm, where it's got very tiny projections, which are hair-like projections, which give it a brush-like look along the border, which again serve to increase its surface area. It doesn't really project very well on the scanned image, but they do have that. So they have these villus projections, and then at the bottom of the villi, there are these crypts, which extend down into the lamina propria. So this is the surface epithelium. So we've got the lamina propria, which has got lots of inflammatory cells in it, which, unlike the stomach, this is normal within the small intestine. More crypts here we can see that have been transected. So we're looking at them in a slightly different plane of section. But these crypts are the same as this crypt here, except we're looking obviously at a longitudinal section, and this is a transverse section through the same sort of structure. Under normal conditions, the villus, or the villi rather, should be 3 times the height, at least 3 times the height of the crypt. So if you imagine, this is the crypt, this is where the crypt's, the base of the crypt, this is the top of the crypt, and this villus should be 3 times the height, which is approximately about right. So under normal conditions, the crypts, also known as the crypts of Lieberkühn, should be a third of the length of the villus. Below that, we've got some muscularis propria, muscularis mucosa along here. And below the muscularis, or sometimes within the lamina propria, we've got these other glands, which are mucin-secreting glands, and they are specific to the duodenum. You don't find them in other parts of the small intestine, and they're called Brunner's glands. So they secrete alkaline mucus, and you only get them in the duodenum. So if you see these, you know you're in the duodenum, as opposed to other parts of the small intestine. So most of these cells here along the surface epithelium are absorptive cells, but occasionally these are these different cells which have this circular globule of mucin in them. These are secreting mucin, and these can look a bit like, or has been described a bit like, a goblet. So these are a goblet cell, and they are packed full of mucin, and these are secreting mucin. So these are the secretory cells interspersed with a lot of the absorptive cells within the surface epithelium. So we've got absorptive cells, we've got our goblet cells, which are doing the secreting, and there's right at the base here, there's another couple of different types of cells. So we can see interspersed among these other ones, there are these cells with these pink granules. So this is a cell with a nucleus here, basally located nucleus, and above that are these pink granules. So this cell is known as a Paneth cell. There's quite a lot of them here, actually. All of these are Paneth cells, more Paneth cell, more Paneth cell. This one is different though. Although it looks almost identical, it's just flipped the other way around. So the nucleus is at the top, and underneath that is are the secretory granules. So this is a neuroendocrine cell. So these are the cells that might be secreting CCK, for example, to provoke pancreatic exocrine secretions. So these are neuroendocrine cells. But these other ones are the Paneth cells, and Paneth cells, I think, have a role. They've got antimicrobial properties, this stuff that they secrete. So we've got Paneth cells, neuroendocrine cells, absorptive cells along the surface, goblet cells, and below that, the mucus-secreting Brunner's glands. Between all that, there's lamina propria stocked full of inflammatory cells, which is a normal component within the duodenum. And that's really all there is to say about duodenum. So there's a few things that you want to look at when you're looking in the duodenum. The first is to look at the architecture, and also to look to see if within the surface epithelium, if there's an increase in intraepithelial lymphocytes, if lymphocytes are among these. Because if you've got an increase in lymphocytes within the surface epithelium, and the architecture is distorted, i.e. the villi to crypt ratio is not 3:1, it's under 3:1, you get a loss of the villi and crypt hyperplasia. Those are the features of celiac disease. But it's beyond the scope of this video to talk, more about that really. And this is not an example of celiac. This is normal, but that's one of the things you're looking for. Another thing you can see within the duodenum is little Giardia organisms, which look like little pear-shaped smudges with near the brush border here. But these are not. That's not what this is. These are erythrocytes, which I can tell because these have got this kind of concave shape, and they're just all cytoplasm, all taken up eosin, so they're just cytoplasm with no nucleus. That's what an erythrocyte looks like. So that's not Giardia. That's just the erythrocytes. But that's one of the other things you can look for. Sometimes you can see granulomas as well, which can indicate a subtype of inflammatory bowel disease called Crohn's disease. And they're probably the main things that you might see in the duodenum. And generally, what you're looking for is to rule out celiac disease, because sometimes you can see the features of celiac disease without obvious endoscopic abnormalities. So endoscopists often take biopsies, and the question will be, is there evidence of celiac disease? But anyway, that's for another time. This is an example of normal duodenal mucosa. So within the rest of the small intestine, it would look pretty much similar, except you would not see, if you weren't in the duodenum, you would not see Brunner's glands, and you might see more prominent lymphoid aggregates. Let's see if we can see an example of a lymphoid aggregate here. There's not a good example of a lymphoid aggregate here. This is beginning to look a bit more like one. But when you have lots of marked aggregates of lymphoid cells, you might see that more distally within the small intestine, and they're the Pear's patches. So, but broadly speaking, the small intestine all looks roughly like this. Okay, so the last in the series is I'm going to talk about the large bowel, which I'm going to talk about in the next video. Okay, great. Speak to you soon.